And what they've shown with COVID is that it actually remains in the air. So unlike the flu, where you basically have to have somebody sneeze right in front of you, COVID can stay in the air as droplets, and you can walk through it even after the person has left the area, which is...
What can they do, and what can people around them do to sort of, I guess, help them with some best practices for anyone who's immune compromised?
So the best way to protect people who are immune compromised, or any people, is to just not get infected. So even though restrictions have been relaxed, mostly because they're trying to push the economy, not because the virus has slowed down. I mean, we have record new cases in Texas today. But what we can do to protect people is to try to protect ourselves from infection. So one is wearing that mask. Nobody likes to wear them. I hate smelling my own breath. Nobody likes it, right? But I've been saying wearing a mask is the new I love you. We wear a mask to protect others. I just had delivery of food the other day, and the man who delivered it wasn't wearing a mask, and he told me, well, I feel healthy. I said, don't wear it for you, wear it to protect me. How do you know I'm healthy, right? So he didn't understand that. So I think a lot of people are confused, and they think mask wearing is to keep themselves safe, and if they feel healthy, they don't bother. But we wear it just in case you happen to be a carrier that does not have symptoms. And so the primary spread nowadays is by people who are not symptomatic. We call them carriers. They're shedding virus, but they're lucky enough to have strong immune systems where they're not experiencing any symptoms. So masks are number one. If you really want to protect yourself, also wear goggles. We now have had people who have been infected primarily through their eyes. So if there's droplets in the air, one other direct passageway into your body is through your eyes. So if you can wear glasses, sunglasses, goggles when you're out in areas where there's other people more closely together, for example, if you have to go to the store, that is going to protect you much better. And then really maintaining that distance. I've seen people where they're not really standing 6 feet apart, they're standing like 4 or 3. So I've been saying stand 10 feet apart. Let's not try to estimate it. Don't try to think, well, my husband's this tall, so let's stand far enough apart that you can hear each other, but you can't breathe on each other, because a good sneeze can travel pretty far. So, and what they've shown with COVID is that it actually remains in the air. So unlike the flu, where you basically have to have somebody sneeze right in front of you, COVID can stay in the air as droplets, and you can walk through it even after the person has left the area, which is more scary. So you want to really maintain that distance. I'm not worried as much when people are outdoors and there's wind and things moving, but people are now starting to congregate more indoors. And when you've got recirculated air, you are now creating really bad conditions for spreading. That's why airplanes are so bad for spreading infections, is that air is circulating around. So if you do need to go out, make sure you're standing apart from people, you're wearing protection, avoid places where you can be sitting or standing indoors close to other people. If you need to have something and you have immunocompromised people in your home, if you need something, please get it delivered. If you can't afford to pay the cost of delivery fees, maybe someone from your church can deliver it. Maybe you have a friend who's going out and about who can leave it on your front step. This is the time to rely on others and to ask for help so that we can protect the most vulnerable.